What's going on, guys? Medicine in 3 minutes, back here with another video, and today we're going to be talking about Crohn's disease versus ulcerative colitis, and we're going to go straight to the point, and the subject is going to be clearly made and often illustrated. So let's get started. So yeah, in this video we're going to be talking about Crohn's disease and ulcerative colitis. These are mainly affecting the colon, as you can see here, and we're going to talk about what they do and what they don't have in common with their treatment and their symptoms and their diagnosis. So yeah, let's get started. So what do they have in common? So common symptoms are pain, diarrhea, and bloody stool. In extradigestives, you'll find in the joints ankylosis, in the eyes you'll find iridocyclosis, and in the skin you'll find nodosum pyoderma. So that is important to note. In the diagnosis, you can do barium enema or an endoscopy. And for Crohn's disease, you'll want inflammation, which is transmural, and the whole thickness of the bowel is affected. So as you can see here, every single part of the surface area is affected, and it does skip lesions. So in the colon, as you can see here, there are some parts that are affected and some parts that are not, and it does not spread continuously throughout the colon. And we'll see how that differs from ulcerative colitis in a minute here. But yeah, so it skipped lesions, and the structure is leading to obstruction. So as you can see here, it does lead to obstruction, and it can happen anywhere in the ileum, small intestine, or colon. But the rectum is spared, so it is not affected by it. There's also vitamin D and B12 deficiency, and the symptoms could either be intermittent, so it comes up and go as flare-ups, or chronic. So yeah, you have to note that. And the diagnosis for this could either be barium x-rays, ABD-CT, or in some cases even colonoscopies. So what is the treatment for this? First line mesalamine 5-ASA. For flare-ups, prednisone, or surgery in 70% of cases. So yeah, it is very important to note that, as it is quite different from the other disease. So yeah, let's get to that. So what is specific for ulcerative colitis? So ulcerative colitis, the rectum is starting point of the disease before it spreads to the colon without skipping lesions. So what does that mean? It means that across the colon, as you see here in this illustration, it spreads clearly across without skipping lesions until it reaches the end of the colon, contrary to Crohn's disease, where it does skip lesions occasionally. So yeah, it is important to note that. And there's abdominal pain in the left lower quadrant, so it is important to note that too. And tenesmus, which is straining during bowel movement. And for the diagnosis, sigmoidoscopy and supraartificial mucosal inflammation. And don't forget, contrary to ulcerative colitis, it is not transmural, but inflammation in Crohn's disease is transmural, as we can see here. So yeah, there's an NCA+, which is basically anti-neutrophil cytoplasmic antibodies. You must take those, and it is always associated primary sclerosing cholangitis. So yeah. For the treatment, if it is a mild case, you'll want 5-ASA, which is mesalamine. If it is a moderate or severe case, you'll want prednisone, surgery in 1/3 of cases. So in 33% of cases relative to 70% of cases in Crohn's disease. So, but however, in UC, it can lead to cancer in a lot of cases. So it is very important that you diagnose it quick and you find a treatment very quickly. So yeah, that about sums up Crohn's disease versus ulcerative colitis. And I just want to thank you guys for watching. Please click the like button and subscribe. That'd mean a lot. And thanks a lot for watching, guys. Enjoy the rest of your day.